The fluorescent lights hummed their monotonous dirge above St. Michael's ICU in Raleigh, a sound Laura Bennett had learned to filter out somewhere around week 3 of her nursing position. Antiseptic and floor wax mingled in the recycled air, the smell of institutions where people either got better or stopped breathing altogether. She moved through the veteran care wing with a kind of quiet efficiency that made her nearly invisible, which was precisely the point. 3 months into the job. 3 months of keeping her head down, her voice soft, her hand steady on patients who couldn't complain if she did anything wrong. The folded flag sat on the bedside table in room 347, placed there by some volunteer from the Daughters of the American Revolution 2 weeks ago. Laura straightened it with ritual precision, the way a spotter would. The way someone who'd held the fabric in the rain over a body would. The Navy SEAL in the bed had been unconscious for 5 years. No movement. No response. Just the ventilator wheeze and the cardiac monitor's steady beep. James Morrison. Call sign Prophet. Her spotter in Tikrit. She checked his vitals with unusual thoroughness, the digital readouts glowing green against the darkened room. Blood pressure 118/74. Reasonable. O2 sat 96% on his current FiO2. Heart rate 62, a SEAL's resting rate even in a coma. She reached for his wrist, felt the slight swelling around his foresight, and made a mental note to escalate the line placement to a larger gauge before infection set in. The next shift wouldn't think to look. They never did. "You're going to be fine," she whispered, the words meant for someone who couldn't hear them. "I'm going to make sure of it." She spoke to him the way you speak to the dead, remembering things only the two of them would know. Tikrit. June 2019. The moment the IED detonated 40 meters from their extraction point. The way Prophet had thrown himself across her position, bleeding, still moving to get the wounded Marines into the truck bed. The way she'd applied a combat tourniquet at 14:23 hours and promised him she'd find him again if he made it out. He'd made it out. Just not in a way anyone could have predicted. The door opened without a knock. Dr. Mercer entered the room with his clipboard held like a scepter, his eyes already moving across the space with the practiced assessment of a man accustomed to rooms rearranging themselves according to his preferences. Late 40s. Expensive watch, a Rolex Submariner, she noted automatically, the kind of timepiece that announced itself. His white coat carried the weight of 15 years of being right and reminding people of it. Ms. Bennett. Not a greeting. An acknowledgement of her presence in his space. Patient vitals. Stable. No change in his status. I've been monitoring for signs of. The numbers. Laura pulled up the electronic chart. Her jaw tightened by approximately 1 millimeter, the kind of movement only visible to people trained to read the micro-expressions of people being dismissed. BP 118/74. HR 62. Temp 37.1 Celsius. O2 sat at 96%. Dr. Mercer scrolled through her notes, his eyes moving faster than his comprehension, the way men often did when they'd already decided what they were going to find. You've logged an foresight concern 3 times in the past week. The current line is showing early signs of extravasation. A 20 gauge would be more appropriate for maintaining access without. The current line is appropriate. He didn't look up from the chart. Your job is to monitor vitals and report changes. Not to practice medicine. She didn't flinch. Didn't blink. The trembling wasn't fear. It was restraint. Laura had held a dying man's hand while rounds of 7.62 millimeter ammunition kicked up concrete around them. She had watched Prophet take shrapnel meant for her. 3 months of Dr. Mercer's contempt was not going to crack the composure that had been forged in Fallujah, refined in Helmand Province, and sharpened across 1,000 impossible choices. Understood, Doctor. Good. Keep the lines exactly as they are. If you're uncertain about protocol, ask a resident. He turned to leave, then paused, not a genuine pause, but the calculated kind where someone wants you to know they've thought of something cutting. Your notes on patient interaction are verbose. The man is comatose. He doesn't need conversation. He needs observation. The door clicked shut behind him. Laura stood motionless for 3 seconds, her right hand resting on the bedrail. Then she leaned down close to Prophet's ear, her voice dropping lower. 12 years, James. 12 years you waited for me to get to you. Not going to let some administrator with a Rolex tell me how to save your life. But that wasn't the worst part. The worst part came at 14:22 that same afternoon when she was placing an emergency line on a trauma admission in Bay 3, a 73-year-old male with acute arterial occlusion, and a visiting combat medic from the 160th SAW Night Stalkers rotated through the trauma bay for a credentialing observation. Tall. Scarred across the left temple. The kind of face that came from being present at violence and surviving it. He stopped moving. Just stopped. His eyes locked on her hands as they moved through the procedure, the needle insertion at a precise 30-degree angle, the flash of blood in the catheter hub, the 2-layer subcutaneous anchor stitch, and then the signature 3rd layer she developed in the field, a reinforcing suture through the skin and back into the subcutaneous tissue, creating a lock no sudden movement would displace. A technique taught to exactly 3 people, herself, Prophet, and the combat surgeon who'd trained them both. The medic's expression shifted. Recognition. Not the friendly kind. The dangerous kind. Laura finished the final suture and applied the sterile dressing without looking at him. The room hummed with the sound of monitors and the ventilator in the corner, that steady mechanical breathing that mimicked life without being it. She felt him watching her. Felt the weight of his understanding settle over the room like weather. She didn't look up. She met his eyes for exactly 1 second, a single glance that carried all the information he needed. The request was silent. Don't say anything. Don't blow this. Don't ask. The medic held her gaze for another moment, then nodded. Micro. Almost imperceptible. Then he stepped back, making notes on his own clipboard with a kind of focus that suggested he'd seen nothing at all and would remember nothing about the rookie nurse with the scarred hands and the combat surgeon's suturing technique. He left the trauma bay without speaking to her. That silence was its own kind of respect, the respect between soldiers who understand that some identities are temporary, some missions are covert, and some people are far more than they appear. Laura stripped off her gloves and headed toward the supply room. She needed new fill lines for the ICU. She needed to check if anyone had actually ordered that 22 gauge for Prophet's arm. She needed to move through this hospital like exactly what she appeared to be, a 3-month rookie nurse with steady hands and careful eyes. She didn't need anyone knowing that Captain Laura Bennett, the one they'd called Raptor in Tikrit, the one who'd pulled 13 people out of a collapsed building, the one who'd earned a reputation for moving through chaos the way other people moved through doorways, was standing in the supply closet of St. Michael's Hospital in Raleigh, North Carolina, counting for catheters and planning how to save the man who'd saved her life. The fluorescent lights above the supply shelves buzzed their endless mechanical song. The conference room at St. Michael's held the kind of silence that comes before a storm. 20 medical staff, residents, fellows, attending physicians, sat in tiered rows facing the projection screen. Dr. Mercer stood at the lectern like a prosecutor building a case, and Laura Bennett stood at the back wall with her notepad, waiting to be dissected. "This is what happens," Mercer said, holding up a chart with a casual contempt of a man displaying contaminated waste, "when we prioritize compassion over clinical rigor." The chart was hers. Room 347. 5 years. Navy SEAL James Morrison, unresponsive for 60 months, breathing through a ventilator tube, maintained by a feeding port, monitored by machines that tracked his descent into irreversible stillness. She had written those notes. Every word. Mercer read them aloud, each sentence stripped of context and intention. Patient responds to familiar voices. Slight finger movement observed. Small voluntary grimace during assessment. He paused, let the weight of those words sit. This nurse thinks she can wish him awake with bedtime stories. 5 years, people. This man has been gone for 5 years. Laughter rippled through the residence, not cruel, exactly, but complicit. The kind of laughter that happens when someone in authority gives permission for ridicule. Laura's jaw tightened. A muscle jumped once in her cheek, visible and involuntary, the only tell of anything beneath her composure. Her hand stayed perfectly steady at her sides. Notepad. No tremor. No clenched fists. No retreat into anger or shame. We have a term for this, Mercer continued, making eye contact with her across the room. His voice dropped to a tone he probably thought was clinical but was really just theatrical. It's called false hope. And false hope is cruel. It's not medicine. It's wishful thinking dressed up in professional language. Laura met his gaze without flinching and continued writing notes as though he were discussing someone else entirely. Not as though she wasn't listening. As though this moment mattered so little she could compartmentalize it with the same efficiency a trauma surgeon clamps a bleeder. She knew what he was doing. Establishing dominance. Making an example. Building a record. 30 minutes later, she refilled her coffee at the vending machine on the 3rd floor. The machine hummed its electric song, and around the corner, near the break room where Mercer stood with 2 residents, his voice carried clear and deliberate. Bleeding hearts like Bennett are dangerous, he said. Not whispered. Not private. She's got boundary issues. Thinks she's practicing medicine instead of following orders. One of the residents asked if administration knew about the concern. Laura added creamer to her coffee with steady hands. Measured. Calm. The kind of calm that comes from having already survived the worst. I've already spoken to them, Mercer said. She pushed back on my clinical decision twice this week. Once more and she's done here. Security will escort our little Florence Nightingale out the door. Laura took a sip of her coffee. It was still too hot, the kind of heat that burns your mouth if you're not careful. She didn't react to that either. She simply walked past the break room entrance, past Mercer and the residents, without acknowledgement, as though his words were background noise, irrelevant as the overhead paging system announcing a pharmacy delivery. But that wasn't the worst part. The supply closet on the 4th floor was narrow and institutional, lined with metal shelving that held gauze rolls, saline bags, catheter kits, and the 1,000 small tools of keeping people alive. Laura closed the door behind her. The fluorescent light above flickered in that annoying rhythm that made the silence feel deeper instead of quieter. She pressed her forehead against the cold metal shelving. The temperature shocked through her skin. She held it there for 4 breaths, in through the nose, out through the mouth, counting in Arabic like she'd been taught 17 years ago in a military hospital in Qatar. Her hands were shaking now. Not visibly. Not enough that anyone looking at her would notice. But her fingers curled into fists and she deliberately, methodically relaxed each one. Index finger. Middle finger. Ring finger. Pinky. Thumb. Then her palms opened flat against her thighs. She stared at the scars on her hands, the one across her left palm from field surgery gone wrong in Helmand Province, the thin white lines from shrapnel extraction in Tikrit, the deep burn mark from a 14-gauge needle that had gone through her glove during a mass casualty event. Hands that had held lives together. Hands that had sewn human tissue back into something functional. Hands that had been trusted with the most intimate and desperate moments of 100 soldiers' lives. Those hands were now being told they were dangerous. Laura counted to 10 in Arabic again. Then she returned to the 4th floor with perfect professional neutrality, face reset, composure restored like someone changing into fresh scrubs. The only evidence of what had happened in that supply closet was the faint red mark on her forehead where the metal had pressed, barely visible to anyone who wasn't looking for it. She passed room 347 on her way back to the nursing station. The door was partially open. Inside, James Morrison lay motionless in the hospital bed, his chest rising and falling in rhythm with the ventilator. The monitor above his head traced out the steady pattern of a man suspended in time. 5 years. 60 months. 1,800 days since the IED in Tikrit had taken everything from him except his heartbeat. There was a visitor in the room, a man in captain's dress blues with combat medic insignia, reviewing Morrison's chart with the focused intensity of someone reading something he wasn't supposed to know how to read. Laura recognized him from Tikrit. Different unit. Different timeline. But he was studying the recent lab work, the vital trends, the notes on Morrison's neurological responses, like he was looking for something specific. He looked up as she passed the window. Their eyes met for exactly 2 seconds. Laura offered a single, almost imperceptible shake of her head. Not now. Not here. Silence. The medic understood. He nodded once and turned back to the chart as though they'd never exchanged a glance. That night, Laura worked the night shift. The hospital settled into its different rhythm after dark, fewer visitors, dimmed lights in the hallways, the feeling of being inside a ship sailing through sleep. She made her hourly checks on room 347, monitoring vitals, assessing for changes. The SEAL's breathing patterns had become irregular. His oxygen saturation was trending downward. Small things. Subtle. The kind of deterioration that might be nothing or might be the beginning of something serious. She called for the attending physician at 2:53 a.m. and reported her findings. Increased respiratory distress. O2 sat down to 92. Heart rate elevated. I'm concerned about possible tension pneumothorax developing. Dr. Mercer arrived in person, his white coat still crisp despite the late hour, his demeanor carefully controlled. He reviewed the monitor without touching anything, confirmed the vitals, and delivered his assessment with the precision of someone already knowing the conclusion he wanted to reach. Hypervigilance from an over-involved nurse, he said. Not to her. To the resident shadowing him. Stop looking for problems that don't exist. Room 347 is stable. I want her reassigned to the surgical floor for the remainder of the shift. It wasn't a request. It wasn't a discussion. Laura accepted the reassignment without argument, without expression, her face reflecting nothing but acknowledgement. Understood, doctor. As she turned to leave the room, the medic from Tikrit appeared in the doorway with a different patient, a post-op trauma case requiring an emergency central line placement. The attending physicians were occupied. Laura was the closest skilled nurse. I need a line, the medic said. 18 gauge minimum. Femoral access preferred. Whomever does this needs to be precise. Mercer gestured dismissively toward Laura. Bennett can handle it. She moved to the patient's side with the fluid precision of someone who had performed this procedure 300 times. 298 of those times in combat conditions where precision meant the difference between a soldier going home or going into a flag-folded box. She prepped the site. Lidocaine. Palpated the femoral artery. Found the landmarks. The needle went in. The Seldinger wire followed. She made 3 perfect sutures, the distinctive technique taught only in advanced combat medicine courses, the method that left a surgeon's signature as clear as handwriting. Layer 1. Layer 2. Layer 3. Exact spacing. Exact depth. The kind of work that made other medical professionals stop and stare. The medic watched every movement. His eyes tracked her hands like he was watching choreography he'd been waiting to see again. Recognition flashed across his face, not shock, because he'd already suspected. But confirmation. Laura met his eyes with a single, almost imperceptible shake of her head. The same gesture she'd given in the doorway. The same message. Silence. He nodded once and turned back to his patient without a word. But that wasn't the worst part either. The rest of the shift, Dr. Mercer altered the staffing assignments. The system showed room 347 assigned to a different nurse. When Laura attempted to check on Morrison, first at 3:15 a.m., then again at 4:30, finally at 5:45, she found that access had been systematically restricted. Mercer had redrawn the rotation. She wasn't Morrison's nurse anymore. She wasn't even assigned to that wing. From the surgical floor, she watched the central monitor at the nursing station. Morrison's O2 saturation continued to drift. 90, 88. 86, his heart rate climbed. 98, 104. 110, the slight deterioration she'd noted had developed into something more serious, something that required intervention, something that needed immediate attention from someone who understood what she'd been trying to communicate. The assigned nurse, a competent practitioner but not someone who'd spent 5 years studying this particular patient's subtle responses, noted the changes at 6:12 a.m. By then, Morrison's chest wall was beginning to show the signs of respiratory distress. The thing Laura had warned about was happening. 30 seconds. That's all it took to change everything. Tuesday night at St. Michael's arrived like every other night, fluorescent lights buzzing overhead, the relentless beep of monitors creating a rhythm that only hospital staff could sleep through. Laura Bennett had been called in at 10:53 p.m. for the veteran wing. 2 nurses had called out. Staffing crisis. She'd made the drive from her apartment in 12 minutes, breaking exactly one traffic law, knowing what waited in room 347. The Navy SEAL had been silent for 5 years. Completely still. Completely absent. But his body still moved, still breathed, still responded to the world around him in ways nobody understood anymore. By 11:38 p.m., Laura stood at his bedside with a blood pressure cuff and a practiced expression that betrayed nothing of what she already knew. The monitor told her a story the attending physician had somehow missed for 6 hours straight. His oxygen saturation at 91%. His respiratory rate elevated to 28 breaths per minute. The numbers didn't scream. They whispered. And Laura heard them the way a trained operative hears a tripwire before stepping on it. She placed her palm against his ribs without asking permission from anyone, felt the asymmetry immediately, air where air shouldn't be, pressure where only lung tissue should exist. Tension pneumothorax. His right lung had collapsed. The pressure inside his chest cavity was building like a compressed spring, pushing against his heart, crushing his ability to breathe. He had maybe 4 minutes before his heart stopped compensating. Maybe less. She hit the code button and didn't wait. Waiting was what killed people in trauma. Waiting was what got good soldiers killed in Tikrit. Waiting was a luxury neither of them could afford. The attending was still pulling on gloves when Laura grabbed the needle, a 14-gauge angiocath, 18 centimeters long, the kind of equipment that felt like an extension of her own skeleton. She didn't explain. Didn't request. Her hands moved with the muscle memory of 100 field operations, 100 moments where hesitation meant watching someone die. She located the landmark, second intercostal space, midclavicular line, the exact geography of survival she could find in complete darkness, and her needle went in. The hiss of air escaping sounded like a breath finally released. Like pressure finally breaking. Like the sound of a man getting his life back, molecule by molecule. His oxygen saturation climbed, 75. 82. 88. Stable. She withdrew the needle, left the catheter in place, taped it down with the precision of someone who'd done this exact procedure in a forward operating base while rounds were still coming down range. Her hands were steady. They were always steady. The trembling, when it came, would be private. Everything else was performance. The attending stared at the monitor, then at Laura, then back at the monitor again. His mouth opened. Closed. Who authorized you to? Patient presented with clear signs of tension pneumothorax. Laura cut through his question like a surgical blade. Respiratory distress, decreased breath sounds right side, O2 saturation 91% and dropping. Intervention performed at 11:16 and 32 seconds. Catheter placed, air expelled, patient now stable at 92% O2 and rising. She was already making notes in the electronic chart, each keystroke deliberate, clinical, documenting everything with the precision of someone who knew this moment would be examined later. I recommend chest X-ray to assess pneumothorax size and recommend observation for possible chest tube placement if reaccumulation occurs. The attending nodded slowly, still processing the reality that a nurse had just performed a procedure that should have killed the patient if done wrong, and instead had just saved his life. He didn't say thank you. He didn't say anything. He just started writing his own notes, addendums, documentation that would make it very clear that he'd been the one making decisions, even though everyone in that room knew the truth. The combat medic witnessed the entire sequence from the doorway. He'd been doing rounds when the code alert came through, just passing time, just checking on old friends who were still breathing but no longer conscious. His expression never changed. Not when he watched Laura move. Not when he heard the hiss of released pressure. Not when he saw oxygen saturation stabilize on a monitor that had been showing critical numbers moments before. He simply nodded, one small movement of his head, and turned away down the hallway. He'd already known. The suturing technique had told him months ago. But now he'd seen something else, operational calm under pressure. The kind of calm that only comes from having already survived the worst. But that wasn't the worst part. The worst part arrived 6 minutes later. Dr. Mercer stood in the doorway of room 347, still wearing his white coat like a uniform, like a flag of authority. He looked at the patient. Looked at the monitor displaying stable vitals. Looked at Laura completing her documentation with the same steady hands that had just saved a life. His face showed no anger. No outrage. No reaction that would give away what he was planning. Instead, his expression showed cold calculation, the kind of look a man has when he's already decided someone's future and is simply going through the motions of waiting for the paperwork to catch up. He turned and walked back into the hallway. Laura heard him before she saw him make the first call, his voice too low to distinguish words but carrying the unmistakable cadence of someone delivering orders to someone who actually listened. The call lasted 90 seconds. He hung up and immediately dialed again. The second conversation was shorter. Then a third call, this one barely a minute. By the time the attending had finished his addendum and left the unit, the veteran wing staffing rotation had been completely reconfigured. The overnight charge nurse received an email at 12:03 a.m. reassigning all personnel for the following week. Laura Bennett's name appeared nowhere on the schedule. Not Tuesday. Not Wednesday. Not any day on the veteran wing. She'd saved the Navy SEAL's life and signed her own termination warrant in the same 40 seconds it took to decompress his collapsed lung. She didn't know it yet. Not completely. But the machinery had already started moving, and by morning, Dr. Mercer would be walking into an HR office with a carefully compiled file of documentation, protocol deviations, boundary issues, and authorized procedures. Everything he'd been collecting for 3 months, waiting for exactly this moment when she'd cross a line that was both absolutely necessary and absolutely against every written policy the hospital had on its books. She finished her charting at 12:02 a.m. and took the elevator down to the parking garage, her shoes clicking against the tile floor in a rhythm that sounded like a countdown. The September rain had started, hammering the concrete like applause nobody wanted. She sat in her car for 14 minutes before starting the engine, her hands resting on the steering wheel, her eyes fixed on nothing at all. The Navy SEAL in room 347 would sleep through the night with steady oxygen saturation and a collapsed lung now properly vented, thanks to a woman who'd performed a procedure that was supposed to be impossible for someone without a medical degree, using muscle memory from operations that officially never happened, saving a man whose life she wasn't supposed to know the value of. And by tomorrow afternoon, nobody would be able to prove she'd ever been there. Dr. Mercer didn't shout. He didn't storm out of the ICU or throw instruments or give her the satisfaction of his rage. Instead, he sat at the nursing station at 11:41 p.m. Tuesday night, his hand steady as he dialed his first number. Laura watched from the medication room, pretending to inventory vials she'd already counted twice. The conversation lasted 90 seconds. His voice remained level, courteous even, the voice of a man making reasonable requests to reasonable people. By 12:15 a.m., he'd made his second call. Then a third at 12:34 a.m. Each call shorter than the last, each one a small calculated decision that would reshape the entire ICU rotation. Laura didn't need to hear the words. She understood the language of institutional power, how it moved through phone lines like poison through an foredrip, how it rerouted schedules and access logs with the precision of a surgeon's blade. By Wednesday morning, the staff postings had changed. Laura's name was gone from the veteran ward rotation entirely. She'd been reassigned to pediatrics starting Monday. Room 347 would be covered by rotating day shift nurses, none of them trained in critical combat wound management, none of them aware that the comatose SEAL was deteriorating. His breathing had become labored. His oxygen saturation was drifting downward in micro-increments that the standard monitoring would catch too late. She said nothing. She came to work, performed her duties in pediatrics on Wednesday, Thursday, made small talk with colleagues who treated her exactly as they always had, politely distant, professionally cordial, fundamentally indifferent to whether she existed or vanished. Nobody asked her about Tuesday night. Nobody congratulated her on saving a life. The hospital moved forward like water around a stone, closing seamlessly over the gap where she'd been. By Friday morning at 8:56 a.m., she was summoned to Human Resources on the 3rd floor. The folder on the desk was thick, manila, its edges worn from repeated handling. Dr. Mercer sat beside the HR director with the calm satisfaction of a man who had made every decision correctly. Captain Bennett, the director began, and something in Laura's chest tightened at the use of her rank, but his voice was gentle and apologetic, which was somehow worse than anger. We've received some concerns about protocol adherence. Dr. Mercer has documented several instances of unauthorized procedures. She didn't flinch. Her hands rested flat on her thighs, palms down. She waited. The director opened the folder. Inside were printouts of her notes from Tuesday night. Clinical documentation, technically accurate, stripped of context like skin from bone. Needle decompression performed at 23:41 without physician authorization. Patient interaction extending beyond standard nursing scope, conversations indicating inappropriate personal attachment. Vital sign trending ignored in favor of unorthodox intervention protocols. Each line was technically true. Each line was also a lie. Laura read through them with the same steady breathing she'd maintained during combat operations, the same composure she'd held while watching teammates bleed out. The hospital takes these concerns very seriously, the director continued. His name was Patterson. He had 2 daughters in college and his wife had left him 8 months ago. She knew this because people talked in break rooms, and silence was the best way to listen. Dr. Mercer has provided extensive documentation. We have no choice but to recommend termination effective immediately. Dr. Mercer spoke then, his voice like a tank idling in a garage, all smooth power barely contained. It's policy. I'm sure you understand. Patient safety comes first. Procedures exist for a reason. Nurses who think they can improvise, who can't maintain professional boundaries with patients, they endanger everyone. He looked almost sympathetic. Almost sorry. He was very good at this. Laura looked at the folder, at the meticulously compiled evidence of her own competence presented as proof of her incompetence. Everything in that folder was technically accurate. Everything about her was a lie. She couldn't tell them she was Captain Laura Bennett, assigned to this hospital by the Pentagon to investigate how a senior physician had been systematically altering veteran care records, pulling medication from supply chains that should have never been touched, running an operation that made a SEAL's coma look like an accident rather than what it was, a man whose pharmaceutical deterioration had been carefully managed to look like natural neurological decline. She couldn't tell them that revealing her identity meant mission failure, evidence destroyed, guilty parties walking free. She couldn't tell them that her spotter upstairs had 5 hours of declining oxygen saturation ahead of him, and no one trained to recognize it. I understand, she said. Her voice was steady. Quiet. The voice of a subordinate accepting authority. It cost her nothing to lie anymore. I'll collect my things. The director looked relieved. Mercer looked satisfied. Neither of them saw the thing that happened behind her eyes, the moment when a captain's assignment changed from covert observation to something else entirely, something that would require different protocols, different extraction. She walked downstairs to the locker room, removed the spare scrub she'd kept there, and packed the contents of her locker into a cardboard box. It took 6 minutes. A cracked coffee mug that said "World's Okayest Nurse" in faded letters. A dying succulent in a ceramic pot, its leaves papery and translucent from months of neglect. A photograph in a cardboard frame, her spotter from Tikrit, the man in room 347, holding a folded flag with the precision of a man honoring his dead. They'd taken a casualty together, a combat medic named Cole Rodriguez from 3rd Battalion, 5th Marines, Dark Horse Company. The flag in the photograph was Cole's, folded in the precise triangular geometry that meant everything to the men who'd carried it. Her spotter had held it for 3 hours after the IED, holding it like it weighed 1,000 pounds, holding it like it was the only thing keeping him tethered to sanity. That photograph had been taken at sunset on a FOB in Logar Province, 14 kilometers northeast of Bagram, and her spotter had never been the same after that day. Now he lay 5 floors above her, in a room he'd been placed in by forces that wanted him erased, and she was walking away from him because revealing herself meant losing the chance to destroy the system that had put him there. She walked out through the employee entrance at 9:17 a.m. on Friday, the cardboard box balanced against her hip. The morning was grey, the kind of March weather that felt like the sky was holding its breath. By 2:38 p.m., rain had started, not the kind that fell gently but the kind that hammered like it had something to prove. Laura stood at the bus stop on Fayetteville Street with the box getting heavier, the cardboard beginning to soften at the edges, her clothes soaked through. The photograph inside the box was already warping slightly, the colors beginning to run where the rain had found its way through the cardboard seams. She'd failed him twice now. Once when the IED went off in Tikrit, when the blast had caught him first and she couldn't reach him fast enough, couldn't stop the bleeding in time, had watched him slip away before the helicopter arrived. And now again, when she'd been cut off from protecting him by a man who understood institutional power the way a butcher understands knives. The rain hammered down. A bus pulled up, brakes hissing like something breathing its last breath. The doors opened with a pneumatic sigh. Laura didn't board. She stood there at the bus stop with the rain mixing with something that might have been tears, though her face remained stoic, her jaw set, her composure intact even now when there was no one to see it, no one to fool. The doors of the bus closed. It pulled away. She didn't watch it go. Saturday morning, 9:23 a.m. The automatic doors of St. Michael's Hospital whispered open and Marcus Bennett, 17 years old, backpack rattling like ammunition cans, exploded through the entrance screaming his mother's name. Security moved toward him. He didn't stop. His backpack spilled across the polished lobby floor, metal cases, each one catching fluorescent light like a signal flare. A bronze star hit the tile first. Then a silver star. Then 2 purple hearts, each in its own presentation box, each one a story no one at St. Michael's knew existed. The elevator doors opened on the 3rd floor. Room 347. The Navy SEAL's eyes, closed for 2,087 consecutive days, opened. Not gradually. Not in stages. They snapped open like a vault door. The first thing he saw was a crack in the ceiling plaster. The second thing was clarity he hadn't possessed in 5 years. His mouth moved. One word came out. Whispered. Like a transmission across 1,000 miles of static. Raptor. He knew. Somehow, in that moment between unconsciousness and resurrection, he knew exactly who had been holding his hand at 0300 hours when his vitals tanked. Exactly who had defied orders to stay beside him even after they pulled her from the ward. Downstairs in the lobby, a Marine Corps colonel in dress blues bent down to pick up a citation that had scattered across the floor. He read the words aloud. His voice carried across the empty lobby like a command, authoritative, precise, carrying weight that made the tile itself seem to listen. Captain Laura Bennett. For extraordinary heroism under fire while extracting wounded personnel in Tikrit. The words hung in the air. Before anyone could move, before Marcus could scream her name again, the elevator doors on the far wall slid open. A 2-star general stepped out. One look at the medal spread across the floor. One look at the uniform blue scattered like broken glass. He saluted. Not the casual military gesture civilians mistake for politeness. A full-dress salute, fist to chest, arm extended, the kind of salute you give to someone who has earned authority through survival. The kind of salute you give to legend. Dr. Mercer tried to interrupt. His voice came up from somewhere behind the information desk, climbing in pitch, reaching for control. This is absurd. I was protecting patients from an unqualified. The general's eyes moved to him. Not looked. Moved. Like a weapon tracking. You were addressing a decorated combat physician who has saved more lives under fire than you've seen in your career. Mercer pivoted instantly, his survival instinct sharper than his intellect. Charm. Damage control. If I had known her credentials, obviously I would have. The Marine colonel shook his head once. A single gesture that ended the sentence before it could finish. You knew she saved that SEAL's life Tuesday night. You fired her anyway. The lobby went so quiet you could hear rain beginning outside, the first drops of a storm that would last all afternoon. Rain like judgment. Rain like inevitability. 2 Pentagon officials arrived within 47 minutes. They didn't ask for Laura Bennett. They asked for Agent Raptor. By operational code name. In front of the entire morning shift. The mask was gone. The undercover assignment was compromised the moment Marcus burst through those doors. Everything Laura had been hiding, her rank, her clearance, her mission to investigate irregularities in the veteran care unit, unraveled in front of a lobby full of witnesses. The officials moved to Mercer's office with a warrant and a security escort. The thumb drive in their hands contained every frame of security footage Mercer had attempted to delete from the hospital's system. Footage showing him, alone in the medical records room at 2:13 a.m. on a Thursday, altering patient dosages, changing treatment timelines, falsifying insurance documentation. 7 names on his list. 7 long-term patients. 7 cases where hospital stays mysteriously extended far beyond clinical necessity, each one generating maximum insurance reimbursement. Mercer had been running the scheme for 3 years. The moment Laura's investigation started closing in, the moment she threatened to expose it, he had moved to eliminate her. His persecution of her wasn't about credentials. It was about survival. By Monday morning, Mercer was suspended pending federal investigation. His hospital privileges were revoked. His medical license review was expedited to expedited status, the kind of review that ends with permanent suspension, the kind that gets reported to the National Practitioner Data Bank, the kind that makes you untouchable in medicine for the rest of your life. The residents who had laughed during grand rounds when he held up her notes now avoided eye contact in the hallways. The attending who dismissed her concerns about the Navy SEAL's deteriorating condition requested an immediate transfer to a different hospital system. Mercer cleared out his office under security escort, the same security escort he'd threatened Laura with 3 months ago. 1 suitcase. Some photos from his wall. His nameplate came off the door. His parking spot got reassigned. 6 months passed. Winter came to Raleigh like a punishment, all grey sky and bitter wind. Laura Bennett stood outside a medical supply depot on the industrial side of town, watching through a chain-link fence as Dr. Mercer loaded boxes into a white van. His medical license was suspended. His hospital privileges were permanently revoked. His reputation had been destroyed by his own documented actions, not by rumor, not by accusation, but by his own hands on a keyboard, altering records, destroying lives for billing codes. He wore a company uniform now. Blue polo shirt with the depot logo embroidered on the chest. He drove a medical supply van between clinics, delivering bandages and catheters and oxygen tanks, interacting with patients who had no idea they were being served by a man who had once held power and lost it to rain and medals on a lobby floor. He saw her watching. His hand froze on a box midlift. Recognition flickered across his face, not surprise, something worse. The understanding that consequences were real. He looked away quickly and loaded faster, movements jerky and small, like an animal trying to make itself invisible. Laura didn't gloat. She didn't smile. She just observed for a moment, watched the man who had tried to destroy her carry supplies meant to help people, carrying them with the hands of someone who no longer had the authority to harm. Then she turned away and walked back to her car. Upstairs in room 347 at St. Michael's, the Navy SEAL gripped the folded flag she had placed in his hands the day he woke up and whispered her call sign. The flag was crisp white with navy blue, folded into that precise triangle shape that means sacrifice. He worked with a physical therapist now, taking trembling steps between parallel bars, muscle memory slowly returning after 1,825 days of nothing. His legs shook like new foals. Sweat ran down his temples. Every movement cost him. Every step was a negotiation with 5 years of immobility. Laura entered the room quietly. She wasn't hiding anymore. She wore her rank now, Captain Laura Bennett, clinical consultant for veteran care operations, no longer masquerading as just a nurse, no longer pretending to be anything other than what she was. She steadied his elbow as he moved from one end of the bars to the other. Take your time. 10 words. An order and a promise. Marcus watched from the doorway, proud in a way 17-year-olds rarely are, proud the way sons are when they finally understand what their mothers actually do. The combat medic from the different unit, the one who had recognized her suturing technique months ago, stopped by the doorway, nodded respect to her, and walked on. By week 3 of physical therapy, the Navy SEAL took 6 consecutive steps without the bars. By week 6, he walked to the window and looked out over Raleigh. By week 12, he walked down the hallway beside Laura while she reviewed his discharge paperwork. Laura's photo now hung on the staff recognition wall in the veteran wing. Captain Laura Bennett. 3 service ribbons below her name. Bronze Star. Silver Star. 2 Purple Hearts. The photo showed her in uniform for the first time in St. Michael's history, no longer a nurse, no longer undercover, no longer hiding. Just a soldier who had spent 5 years as both to bring another soldier home. In the quiet moments between discharge paperwork and therapy sessions, in the space where nobody was watching and nobody was recording, she reflected on what power actually was. Dr. Mercer had believed power came from credentials, from titles, from the authority to make decisions about who could help and who couldn't. He had learned the hard way that power isn't a title. Power is the ability to help. The final image was the Navy SEAL gripping the folded flag, the one from their fallen teammate, taking his first independent step without assistance, without parallel bars, without anything except muscle memory and the knowledge that someone had refused to let him stay asleep. Laura watched with quiet satisfaction. No longer hiding. No longer pretending. Just a captain watching another warrior find his way back to standing. If this story moved you, if you understand what it means to be underestimated by someone who doesn't know your actual value, please subscribe, like, and drop a comment. Tell us, would you have walked away? Or would you have stayed? Thanks for watching.